Hello. Hello. Next speaker is Dr. Radha Ramanan from iVision Chalakudi. He will be talking on the corporate and outreach camp activities. Can we do justice to both? So he's from iVision Chalakudi. He was previously at Angamali with our team. Last 35 years, he is doing camps. Forward to Dr. Radha Ramanan.
Good afternoon. And subject I have to talk is corporate and outreach camps. I think the camp Dr. Andrews was explaining was of a different thing, and now the picture is changed. Now it is for the publicity. That is the purpose for either both for charitable as well as corporate hospitals. Earlier intentions, it was mainly to serve the people, to reach out the remote places. Even surgical camps were conducted, as Andrews mentioned. We conducted a lot of surgical camps. Now you know that other than in proper OT, surgical camps are banned. There was no money collected from any one of these patients on that days. Even Modi conducted camps. What is the change at present? Now, of course, the government hospitals also conduct on the mobile eye clinics. Charitable hospitals conduct camps for poor patients. That is there. But even in charitable hospitals, most of the hospitals do it for publicity, and surgery is not completely free. So that is good. Actually, it's not necessary. And few of the surgeries will be subsidized rate. But in Kerala, now the most of the camps are conducted not by the charitable hospital. It is conducted by either the private or the corporate hospital. I work in a private hospital now, and I am conducting camps. The aim is publicity and convert the patients into the paying side. Where are all we conduct the camps? Through the NGOs, we can do it with residential associations, schools and colleges, offices, anywhere. Now it is reached in a stage that we will conduct it anywhere in Kerala. And this is a camp conducted in High Court of Kerala. So that stage we have gone. Facilities for camp, compared to the earlier days, these are all high-tech camps now. The basic refraction is there, doctor consultation that is there. Then along with that thing, auto fundus camera, then optical shop. Now there are mobile eye units which goes into the peripheral and with all the facilities. The main question comes now is whether these camps are needed in Kerala at present. What will be the answer? Say, if it is for the hospital, yes. If it is for the patients, not much, because there are most of them can afford it. But only in remote areas, like some areas in Wayanad, Idukki and all, definitely requires camps. But sometimes this is not correct. I was remembering one of the occasions where Angamali, the government setup was not coming and screening it, because they were telling that LF is there, so no need. And because of that, they want to complete the statistics. They came to Angamali. They found that lot of bilateral mature cataracts. That was surprising. So the camps are mainly at present for the hospitals. Then another system is CASP. That is Karunya Arogya Suraksha Pathadi. It's a good program both by the central government as well as the Kerala government. But the problem with the private hospitals and all is the rates are very low, and you won't get the money at time. And there is a new program called 70 plus, that is Vayo Vandana by the central government of India. And till now it is not implemented in Kerala, because everyone is coming with that cards to most of the hospitals, but it is not implemented in Kerala. This is irrespective of the income of the patient. So even Adani, Ambani is included in the Vayo Vandana. So the question is, who will control the camps? Now it is reached Previously, we were asking for more and more camps. Now, the question comes, who will control the camps in Kerala? You know the rules for conducting the camps? You have to apply to the DMO's office. You have to get the permission. There are a lot of procedures. Rohan is there. He is aware of the procedure. And if you give an application, you won't get a reply within the next year also. So they will tell you that if you want to conduct, you conduct it. There won't be any reply from that thing. You yourself will find it out. Then who will restrict it? KSOS or district associations? How can you control it? Which hospital you will control it? So what are the criteria for camps? These are all the things we have to discuss it. At present, we can tell that there is no control for any one of the camps in Kerala. What are the ethical ways? This is at least the minimum thing we can do it now. Doing whole thing is a difficult one. At least do not conduct an eye camp in front of another clinic or hospital. So sometime it is within 100 meters or just in front of a hospital, because and the same paying patient is going there. You can go and conduct it in the periphery. What is the area of one hospital to conduct an eye camp? Can you define it? So this area is for this hospital. You cannot define it because in the same town, within 100 meters, you can find 4 or 5 hospitals. That is also not possible. So there is no such rules in Kerala. Even outside Kerala, people used to come and conduct camps in Kerala. Who arranges camps? In every hospital. Many times the camp organizers are there in the hospital and they will arrange the camps in association with some NGOs or some other people. And even the doctors in that particular hospital won't be aware of where the camps and what they are doing it. So sometime when you go there, you will find out that you are just in front of another doctor. So because you don't know where you are going, because the hospital, some other people are arranging. That is another difficulty. And most of these present day hospitals will have a target given to camp organizers. And to reach that target, they will do any sorts of arrangements, and even they can, if the number is given to them that a month this many camps, they will split up the camp, they will do all sorts of things, and these type of things are going into an unhealthy way. So what we can do other than, because this is all for the publicity, we should conduct it in some other way, or should not conduct it in front of another hospital and concentrate camps in remote areas. Total free should not be done. I think it's only for the very deserving people. Otherwise, it is not nice. I think ideally we can concentrate on other publicity methods. There are so many. This is all based only on cataract now. So other than that thing, we can conduct it in other way. Hospitals can get publicity, like a World Sight Day. So many things, glaucoma day and all that thing is there. And other education programs also will help the patients. Whether the hospital associations can do anything on this side? This is a question actually I want to ask. I think we have to initiate a discussion among us to have some norms in conducting the camps. Thank you.
Thank you, Dr. Radha Ramanan, highlighting the ethical aspect of conducting camp, especially in corporate sector.